Hi there, I'm Tony Lee, and this is Hot Flasher, your daily menopause podcast that serves up fresh news, research, and wellness tips. I've built a daily news pipeline to find the latest on women's health and menopause research. Allow me to introduce my co-host Nikki, who handles the headlines. Take it away, Nikki.
Thanks, Tony. We've got some serious myth busting to do today. So the FDA just made a pretty major move that flew under a lot of people's radars. In November, they quietly removed the black box warning from hormone therapy products. You know, that scary black bordered warning that's been scaring women away from HRT for over 2 decades. For those who don't know what a black box warning is, it's the FDA's most serious type of warning, short of pulling a drug off the market entirely. Think of it as the regulatory equivalent of those giant warning labels on cigarette packs. When you see that black border, it means the FDA considers the risk significant enough that they want doctors and patients to think very carefully before using that medication. The warning on hormone therapy came out of the Women's Health Initiative study from the early 2000s. That study scared the hell out of everyone by suggesting hormone therapy increased risks of breast cancer, blood clots, and stroke. What followed was basically 20 years of women suffering through menopause symptoms because everyone was terrified of HRT. But, as often happens in science, the story got more nuanced over time. Researchers realised the original study had some serious limitations. Most of the women in the study were older, many starting HRT years after menopause began. The types and doses of hormones used weren't necessarily what we'd recommend today. And the absolute risks, while statistically significant, were actually pretty small for most women. The FDA's decision to remove the warning reflects decades of additional research, showing that for many women, especially those under 60 or within 10 years of menopause, the benefits of hormone therapy often outweigh the risks. It's a recognition that we've been operating under outdated information that kept effective treatment out of reach for way too many women. This matters because fear-based medicine doesn't serve anyone well. When regulatory agencies acknowledge that the science has evolved, it gives doctors and patients permission to have more balanced conversations about treatment options. Now, speaking of fear-based medicine, there's a dangerous trend making the rounds on TikTok that perfectly illustrates why we can't get our medical advice from social media. People are claiming that taking antihistamines like Benadryl along with Pepcid can treat menopause symptoms, and doctors are rightfully freaking out about this one. Dr. Mary Claire Haver, who's become pretty well known for her menopause advocacy, recently had to go on Good Morning America to debunk this trend. The theory seems to be that menopause symptoms are caused by histamine intolerance, so blocking histamine with these over-the-counter medications should help. On the surface, I get why this might sound plausible to people. Histamine is involved in a lot of bodily processes, and some women do notice that certain foods or environmental triggers seem to make their symptoms worse. But that doesn't mean menopause is fundamentally a histamine problem that can be solved with allergy medications. What's particularly concerning is that people are taking these medications long-term without medical supervision. Antihistamines like Benadryl aren't designed for chronic daily use. They can cause drowsiness, cognitive problems, and in older adults especially, they've been linked to increased dementia risk with long-term use. Pepcid, while generally safer, can still interact with other medications and isn't appropriate for everyone. The real issue is that this trend bypasses the actual complexity of menopause. Yes, some women might have histamine sensitivities that worsen during menopause due to hormonal changes, but treating the histamine response doesn't address the underlying hormonal shifts that are driving most menopause symptoms. This is exactly the kind of thing that frustrates me about health misinformation. It takes a tiny grain of possible scientific connection and blows it up into a cure-all that could actually harm people. Meanwhile, we have evidence-based treatments that actually work, but they require having real conversations with healthcare providers. Which brings me to something fascinating that might actually change how we think about menopause and aging. New research using artificial intelligence found that menopause doesn't age all body systems equally. This challenges the common assumption that menopause just accelerates aging across the board. The study used AI to analyse biological aging markers in different organ systems. What they found was that menopause affects some systems much more dramatically than others. The reproductive system obviously shows significant aging changes. But interestingly, the cardiovascular system also showed accelerated aging during menopause, which helps explain why heart disease risk jumps after menopause. However, other systems like the immune system and liver showed less dramatic changes. This suggests that menopause isn't just hitting a fast-forward button on overall aging. Instead, it's creating specific vulnerabilities in certain body systems while leaving others relatively intact. This research matters because it could help us develop more targeted approaches to menopause care. Instead of treating menopause as general aging acceleration, we might focus protection and treatment on the systems that are most vulnerable during this transition. It also validates what many women experience. You might notice your cardiovascular fitness declining or your cholesterol numbers changing, but your cognitive function and immune system might be holding steady. That's not in your head, and it's not random. There's actually a biological pattern to how menopause affects different parts of your body. This kind of precision understanding could eventually lead to more personalised treatment approaches. Maybe some women would benefit most from cardiovascular focused interventions, while others might need treatments targeted at metabolic changes. It's a reminder that menopause research is still evolving rapidly. We're moving beyond the one-size-fits-all approach toward understanding the individual variation in how women experience this transition. So we've got the FDA finally acknowledging that decades of HRT fear-mongering wasn't serving women well, dangerous TikTok trends that ignore actual medical complexity, and AI research revealing that menopause affects our bodies in more specific ways than we realised. What does this tell us about where menopause care is heading? And are we finally moving toward treatment approaches that match the actual science instead of the fear?
Thanks for listening to Hot Flasher. We're back tomorrow with more, so don't forget to subscribe. See you tomorrow.